Good morning, everyone, and welcome to Caffeinate Innovate, where we chat with leading experts in prevention science. Welcome, Jud. It's great to have you with us today.
Thanks for having me.
Yeah. Can you start out by just telling us a little bit about you and your work?
I am an addiction psychiatrist. I'm also a neuroscientist. I'm a professor at Brown University and a practicing psychiatrist. My work, I won't go into the whole thing so we can actually get into a conversation, but for the last couple of decades, I've been really exploring ways that we can help people work with addictions and habits ranging from smoking to overeating to even anxiety, and have had the pleasure of doing translational research ranging from clinical studies all the way to neuroimaging to understand the brain mechanisms.
Awesome. Thank you. I know that this is a really big ask, but can you briefly describe mindfulness to our group?
It's a great question because I think it means a lot of different things to a lot of different people. Over the years, what I've found is that I try to simplify things to the core elements. And so right on cue is my assistant here. So I think of it really as having two key elements. One is this awareness, being aware of what's happening, but having this attitude of curiosity. And if you really had to distill that down into one word, I think curiosity captures it all, because when we're curious about something, we are paying attention in the present moment and we're bringing this non-judgmental attitude.
Awesome. Yeah. Thanks. That was a really great way to capture it briefly. Can you talk a little bit about how mindfulness practices can be used to reduce or prevent substance misuse?
It's a so briefly, because this is something that we and others have been studying for a long time and I've been using in my clinic. There's a paradox here where the dominant paradigm has been willpower. Use your willpower to just stop doing whatever or just don't do it. And unfortunately, that's not how our brains work. And so there's this very it's seemingly counterintuitive element to mindfulness until you understand the neuroscience behind it. And the idea is that we bring awareness in to help us see how rewarding or not rewarding a behavior is. So if you look back at even back to the early Buddhist teachings, they talk about there's this phrase, I'll summarize it as exploring gratification to its end. And it's a really interesting phrase because it lines up really nicely with modern day neuroscience where they talk about reinforcement learning. And the idea is if somebody doesn't see how ungratifying a behavior is, then they're not going to stop doing it. The classic idea in addiction is hitting rock bottom. But I would suggest that people don't have to hit rock bottom. I'll give an example. When I was working at the VA hospital, I had a patient who came in who said, Doc, I feel like my head's going to explode if I don't smoke. And so these cravings can be really strong. And so what I encourage people to do first is to go home. I say, okay, well, you're going to smoke anyway, but so just go home and pay attention as you smoke. And what that helps people see is what the smoke tastes like, what it smells like, what it feels like going into your lungs, and all of this. And they come back pretty universally saying, how did I not notice that in terms of like it wasn't that rewarding? Now, smoking is a relatively clear example of where we can see, that that paying attention helps us become disenchanted. And in fact, we did a randomized control trial where we got 5 times the quit rates of gold standard treatment using these types of practices to really help people pay attention. Now, if somebody's thinking, well, how does that work with alcohol or another intoxicant? It's hard to pay attention when you're intoxicated, right? So and some people can practice doing it, but the idea is, looking at the results of a behavior when after somebody is has kind of sobered up a little bit can actually give them a lot of information in that moment where they can start to see, okay, what did I get from that? And so it helps not only in the moment when somebody, for example, is smoking, helping them get the direct experience, but if somebody's intoxicated, they can also look back afterwards and see what the results are. I'll give one other example. I had a patient who she had well, she came to see me in her late 40s, and she'd been drinking pretty like very heavily since her 20s. She described it. She used to pre-party going to go to the grocery store because she was so anxious. And by this time that she came to see me, she had three teenage kids, and she was really doing things that were very embarrassing for her kids. And so when we got her to the point where she had moments of sobriety, in each morning I would have her wake up and then do a recollection, like a mindfulness exercise, where it's like, okay, what does it feel like now when you didn't drink last night? Where she doesn't have the hangover, she doesn't have the anxiety, she's not embarrassed, her kids, like want to talk to her. And that was so much more rewarding than when she was drinking. That really helped her maintain that sobriety. And then, she took it forward from there. And so every morning she would do this recollection of like, okay, what's it like when it's not this? And what's it like? And recall, she also had to recall what it was like when she did the thing. And so I think those are just a couple of ways where people can bring mindfulness in the moment to become disenchanted with the behavior, but they can also bring mindfulness in afterwards. Somebody doesn't have to go and use or drink or whatever to know to because they've probably collected this huge database that they can just rely back on. And that's still, that can still be extremely helpful for becoming disenchanted with the behavior.
Yeah. So it sounds like it kind of works in, in opposition to the concept that people who are addicted to a substance will compulsively use that substance regardless of the negative outcomes. It's kind of looking at those negative outcomes and being curious about those. And I guess that's the strategy, is using the mindfulness, looking toward the outcome to get curious about how that feels, changing that perception. Um, so it ties into neuroplasticity. Can you kind of describe how mindfulness and neuroplasticity work together?
Sure. So neuroplasticity is a big term, basically just meaning that our brains aren't fixed in time, which is good because our brains need to constantly be able to adapt to our ever-changing environment. And so here you can look at neuroplasticity from a functional standpoint. You can also look at it from a functional neuroimaging standpoint. And so from a functional standpoint, if somebody has a habit of doing something, by definition, they're going to do it automatically. And if we look at this definition of addiction, continued use despite adverse consequences, it can feel like we have no control over behavior and we're just going to keep compulsively doing it, like you mentioned. So here, when we start to bring awareness in, it starts to bring in what's called a positive or a negative prediction error, meaning that if our brain is expecting something to be a certain way and we don't pay attention, we're just going to keep doing it. That's what a habit is. But for example, if somebody pays attention when they smoke a cigarette and they see that it's not as rewarding as expected, their brain gives them a negative prediction error. They get this dopamine spritz, and neuroplasticity takes an effect because they learn something, right? So anytime we learn something, that's actually a small marker of neuroplasticity because our brain is changing in that sense, whether it's changing its receptor density or dendritic arborization or thing, like all these fancy terms in neuroscience that basically just say, hey, our brain can change. It's plastic in that sense. So that's a very simple example of neuroplasticity in effect, and also how the power of awareness, that curiosity can actually drive that neuroplastic change in the brain.
Yeah. So I myself am very results driven. So I'm looking at this, if I were using mindfulness as a technique, or part of my toolbox, I'm thinking, how long? How long do I have to be curious? How long do I have to do these things? Can you kind of elaborate on that?
Yeah, that's the million-dollar question. So if you ask the internet, the internet seems to be trained on a book from the 1960s written by a plastic surgeon named Maxwell Maltz. I wouldn't trace this down, where this 3 week thing, it's like, oh, it takes about 3 weeks to change a habit. So that's based on him reporting on how long it took his patients to get used to their new nose jobs. Okay, so let's just say, don't believe everything you read on the internet. What really is the case, there are studies showing that there's a huge range of change. And what we found in our study, we did a study of people who had been overeating for a long time. And we had them bring awareness in and just really notice the results of what it was like to overeat, right? Really bringing in this awareness, this mindfulness, and this neuroplasticity in the sense that like they can change the reward value in their brain by paying attention. And what we found was so something's rewarding, we're going to do it again. If it's not rewarding, we're going to be less likely to do it again. That's what reinforcement learning is in a nutshell. And so when people pay attention and they overeat, it only takes 10 to 15 times of paying attention when they overeat for that reward value to drop below zero. Okay. So it can happen relatively quickly, which actually makes sense because our brain needs to be very adaptable to, because we have a very rapidly changing world. Like that's just how the world works. And so if it couldn't adapt, it would be hard for us to survive.
Thank you. Okay, so this is another big question, but what are some things that you're doing that are different from what others are doing?
Well, I can't speak for all of the others, but I will say that there are a lot of programs based on on cognitive control or on willpower, right? And so the biggest difference that we have with other programs is that we're not basing anything on willpower. If you look at willpower from a neuroscience perspective, it's more myth than muscle. It's not actually in any of the equations for behavior change, which is kind of interesting in itself. And so we really leverage, what I would say that we're doing different is we're really having people just pay attention as they do the behavior and taking what can seem like a huge leap of faith where somebody says, will paying attention actually help me change a behavior? And we say, well, if you look at the studies, if we look at, we've done a bunch of studies on this now, whether it's smoking or overeating or even anxiety, we've gotten pretty large effects of people using that. So I haven't seen many people kind of instead of running away from or trying to fight the cravings or their emotions, turn toward them. But this goes back to a saying that I learned a while ago. The only way out is through. Or even there's a saying attributed to Marcus Aurelius that what stands in the way becomes the way. And I like that because it suggests that instead of running away from or fighting our cravings or our difficult emotions, we can actually lean into them, right? And this is where curiosity really helps. It's a superpower that helps us not be afraid of our experience, not run away from it, but develop this critical skill of distress tolerance so we can learn to be with it. And we also learn something really critical, which is cravings come and go, right? They don't last forever. I can't tell you how many patients have come in and said, I feel like this cravings lasted forever. And then I ask them, well, how many cravings do you actually have that last forever, right? Because they would still be having that one. None of them do. So I send them home and I say, go ahead and time your cravings. Okay. Any guess as to what the longest on record is? And this is after me doing this for about 10 years.
I think I know because I read one of your books, but if anybody wants to pop their answers into the chat, we can go
Yeah.
ahead and do that.
We'll take a quick 5 second, you get 5 seconds to pop it in before I give the answer. So if anybody wants to throw a guess out there's no right or wrong answer here. Ooh, we
Got
got a
10
range
minutes,
of 1 to 10 minutes, 16 minutes.
16 minutes.
I like the precision on that. 15 minutes, 30 minutes. Yeah, it was so most of y'all are pretty close. It was 12 to 13 minutes. I think it was 13 minutes has been the record so far. And it blows my patients' minds, right? They're like, that 12 minutes was a long 12 minutes, but it was only 12 minutes.
Yeah. Yeah. Thank you for everyone who interacted with that. And thank you, Judd. So my final question that I have is what are some strategies that our attendees can take with them today and implement in the work that they do?
So I would say this is summing up the last 20 years of our work. And I love that you can sum something up in like 3 simple steps because the simpler it gets, I think the often it means that you're really getting at the heart of something. So the first step is for somebody to be able to kind of map out and be able to identify a behavior that they're doing, right? And that's often pretty straightforward, whether it's, scrolling, smoking, overeating, whatever. But the key there is if they can't just pause and see that thing is happening, then they're going to be lost on autopilot. So that's actually a critical first step. The second step is asking a simple question, which is, what am I getting from this? Or if they've done something previously, what did I get from this, right? It's not like they have to go and repeat the behavior. And that really brings in this reinforcement learning process in our brain, a part of the brain called the orbitofrontal cortex, where it can really see like how rewarding is this actually when I pay attention and really look at all of the results. So this is about looking at all the results. Like, so yeah, it felt, it might have felt good at the time, but what came after that, everything. So just kind of bringing that composite reward value to bear through that simple question, and importantly feeling into their body, because our bodies are very wise. They have a lot of information to give us, and often we ignore that. Okay, so that second step is asking, what am I getting from this? And this is where we become disenchanted with the behavior, whether it's smoking or overeating or all the times that we drank too much or whatever. And then the third step is what I call finding the bigger, better offer. And this is where we have two superpowers that are intrinsically available and just things that we often need to dust off. First one's curiosity. We've talked about curiosity a little bit, where it helps us turn toward our experience and not be afraid of it. I love this phrase, curiosity will conquer fear even more than bravery will. So anytime somebody has a craving, they can really start to explore, am I afraid of this? Am I running away from it? And that, oh no, like I have to fight this or I have to run from it. They can start to shift that to, oh, what does this actually feel like in my body? And they can feel how empowering it is to be curious and turn toward that experience. So that's curiosity. The other is, and I see this way too much, unfortunately, but I think this is human nature where people judge themselves. They feel judged. They judge themselves. They feel judged by other people. There's a whole lot of judgment. There's a whole lot of judgment going on in the world right now, too. So it's kind of a societal habit. And so here we can ask ourselves, what do I get from judging myself? And flip that script to, well, what's it like when I'm kind to myself? And sometimes that can be hard to access for some people at first. So here I'll say, well, what was it like when somebody was kind to you? Even a simple act of kindness, and they can start to feel into that. Both markers of both curiosity and kindness are experiential. So we can notice like when we feel anxious, it feels closed down and contracted. When we feel judged, it feels closed down and contracted because we're protecting ourselves. Curiosity and kindness both feel open and expanded. And so we can look at those simple markers as signposts to see if we're actually truly tapping into that authentic curiosity and kindness. So that's the three steps that anybody can use, anybody can implement. And we've found when we bring those forward in our clinical programs, they work pretty well.
Thank you so much, Jud. As promised, I'm going to open it up for our attendees. I'm sure they have some questions for you as well.
How can I incorporate mindfulness in a program helping students with sleep, anxiety, and cannabis use?
That's a great question. So, just to keep it brief, I've written a bunch. I have a weekly Substack newsletter that kind of talks, and it's 80% is focused on anxiety. And in each week, I try to give a little bit of a mindfulness type of practice that we have a clinical program called Going Beyond Anxiety. And so that might be a place you can look through some of my previous Substacks and see if see which, if any, of those might resonate. But there might be a few things that you could explore there. But the key there, I would say, is first, a lot of people don't recognize that anxiety can actually be a habit that's driven like any other addiction. And so that might be an accessible way in that's somewhat counterintuitive at first. And I think I wrote a substack called like, is anxiety actually a habit or something like that? One of the most important things that I never learned in medical school. So that might be a place to start. But then you could just skim through and see if there are, I try to bring some different practices in, and you can see if there are any of those that might be accessible for the project that you're putting together.
We have Erica in the chat who asked, how much more difficult is it to perform mindfulness with a person who has autism?
Great question. So often, and I'm not an autism expert, so as a psychiatrist, I was certainly trained to work with people with autism, but I don't have an autism clinic. What I would say is there's a large spectrum. And there are people that are doing mindfulness work with people with autism. So it really depends on the individual. And I would say here, The key with mindfulness isn't about like, let's do some meditation or something like that. The key I would say is like, where are there moments to access curiosity and just take it moment by moment by moment? And I would say in that sense, you know, I wouldn't go in assuming that it's even more difficult to perform mindfulness with in a person with autism. I would say, here's a wonderful opportunity to explore how to meet this individual with this and help awaken their curiosity. So, Erica, I hope that answers your question and is helpful. Great, great question to be exploring. And also, I think I'll just mention this. Thank you for posting this. There are a couple of links that were just posted. So just to orient people around those links, the mindshiftrecovery.org is a nonprofit that we put together to help people specifically with addiction. So that free resources, folks can check that out. I have some general resources on my Dr. Judd website. We have a new clinical program that we just launched about a month ago for helping people with anxiety, where we do a hybrid approach with humans and also bring teaching assistants that are driven by generative AI into the loop. And then I mentioned the Substack, and that's just judbrewer.substack.com.
Thanks, Jud. Yeah, those are all really great resources. If you're
How can you use mindfulness with overeating when you have to eat daily to survive, unlike smoking or drinking alcohol?
Great question. And we've done some direct research, and I've actually I wrote in the Hunger Habit about a lot of work that I've done with people who've struggled with eating. You're really touching on something really important, which is like we don't have to smoke to survive. Actually, it's anti-survival, but we do have to eat. And so here, one of the things that I have people explore is what I call the pleasure plateau. So, for example, when we're really hungry, and often, I was working with a group of people with binge eating disorder, and it took me a long time to realize that they had actually completely uncalibrated their ability to tell when they were hungry. And one of them summed it up by saying, I don't know, I just have a craving and I eat. And she couldn't differentiate between what's called homeostatic hunger when she was actually hungry and hedonic hunger when she would eat her emotions, basically. And so I'm not saying this is the case for you, but I just mentioned this because this can be really tricky, where we've learned to associate eating with so many things beyond hunger. And so that's one thing to just we can start to unpack those where it's like, oh, am I actually hungry or not? But also, when we are hungry, we did a study with this, and this is the one I mentioned earlier, where we had people pay attention as they ate. What I call this the pleasure plateau. So as we eat some food, excuse me, as we eat some food, if we're hungry, it actually tastes different than when we're less hungry and when we're full. Often people don't even notice that because they're not paying attention when they eat. So this is called the pleasure plateau, where it's there's this it tastes good for a while and then it stops tasting so good. And the key is to really pay attention, like, is this bite better than, worse than, or the same as the last bite? So we can really bring that curiosity each bite. And it helps us kind of coast to a stop on the pleasure plateau. It takes about 15 to 20 minutes for our body to register fullness. So we can't be rushing through a meal here. But if we don't pay attention, we go over what's called I call this the cliff of overindulgence, right? And so, this is like, oh, I didn't need to eat that much, but I didn't pay attention, so I just went off that cliff. So as we pay attention, it can be this great exploration to be like, oh, how much do I actually need right now for this hunger? Because it can change, right? It's not that, oh, this is lunch and this is how much I eat at lunch, right? That's a habit. It's like, oh, what is my body calling for right now? What type of food? How much? And we can actually answer that question by really just paying attention with each bite. Our body will tell us so much. It'll tell us basically all we need to do. So, they're following the mission impossible. There's your mission should you choose to accept it, right? There's lots to explore, and all it requires is curiosity. Yeah, you don't need to read my book. That's everything.
I would recommend reading the book. It was a good book. All right. We probably have time for one more question before we wrap up.
How do we need to adapt these practices when working with adolescents?
Yes. So we in particular are doing a fair amount of work now with people, let's say people as young as 12. So mostly adolescents, and really focusing in on anxiety. Because anxiety drives a lot of unhealthy behaviors, whether it's scrolling or eating or whatever, right? So we have a fair amount of experience with that, and we're actually testing out ways to meet them where they're at. And so unfortunately, a lot of young people have kind of grown up on screens, and so they feel more comfortable texting or interacting with something with their phone than actual people. And of course, their parents forget about it, right? So what we're doing is we're just pilot testing now in this Going Beyond Anxiety program, ways to actually meet youth through kind of a human supervised generative conversational agents, where we can train them. This is with anxiety in particular. We can train them how their brain works and how to use our brains, but in a way that leverages AI as a teaching assistant. So it's kind of a companion as compared to somebody that's hierarchically like trying to tell them what to do or this or that. And we can pair that with basically podcast style delivery of psychoeducational content.
Thank you everyone for joining us today, for your ideas and input. If we did not get to your question or you didn't get a chance to ask it, those follow-up resources, Megan, if you want to just put those back in the chat again, we have those links. They're not very far up, but you can go there to follow up, learn more about Jud's work. Thank you all for your attendance and participation. We've got some links and QR codes that Megan will